Now I'd like to bring to the stage Dr. Suzanne Steinbaum. Suzanne is one of the nation's leading preventative cardiologists. She's been the director of Women's Cardiovascular Prevention, Health, and Wellness at Mount Sinai and the director of Women's Heart Health at Lenox Hill Hospital. She is a former spokesperson for the Go Red campaign and the American Heart Association, and she is currently founder CEO of Adesso, which is an AI-powered company that discovers and treats cardiac risk through customized health and wellness programs for wellness. An author, New York Magazine's Top Doctors, Suzanne's mission is to bring cardio prevention to every woman, regardless of location or circumstance. And she's also glamorous.
Thank you for being here. We talked, briefly the other day on the phone, and we both agreed we could just talk for hours about this subject, and unfortunately we have 15 minutes. But how did you decide to take these AI tools that we have and really turn it for functional use to help women in their health?
When I started, it was a little over 20 years ago, and there was literally no such thing as women in heart disease. At that time, I was working in the emergency room. I was in my training, seeing women being brought in and actually having heart attacks in the emergency room without being diagnosed. Throughout the past 20 plus years, we know that women are more often misdiagnosed, undertreated. 50% of women who go to the emergency room who actually have a diagnosis of a heart attack, the initial diagnosis is usually wrong. It takes 20 years for research to get to your doctor's office. So AI is a faster way to help us accurately diagnose, accurately assess, and quite frankly, it takes away the subjectivity of the doctor having an opinion about who you are and makes it extremely objective for them to do the right thing.
So, and I think it's really important because one of the things that we also spoke about is that doctors tend to be a little dismissive sometimes and say, oh no, that's normal, that's fine.
Yeah.
You want to talk a little about maybe some specifics where this AI tool can help?
When someone says to a woman, do you have chest pain in the setting of having a heart attack? Very often the answer is no. And I started asking many years ago, why did you say no? After the follow-up. And he said it wasn't pain, it was pressure. And so the words, the language, we are really confined by language. We all speak a little differently, even if we all speak English. And so AI is a way to really streamline. And I wonder if we put in ChatGPT and say, what is the most common symptom when women's having a heart attack? It's most likely going to say shortness of breath and chest pain are the most common. Well, I didn't have pain, I had discomfort. How do I talk to my doctor? It's interesting if you start utilizing that tool, because what you'll find out is it's assessing so many hundreds and thousands of women who had these issues and putting it all in one place to answer your question. And so the most important thing we know about AI and how it could help you and how we're utilizing it in Adesso is we're taking what's out there in the hundreds and hundreds and hundreds and hundreds of thousands of millions and millions of millions of women and putting it on a platform to help us accurately diagnose women, to accurately assess. And the other thing we're doing is making My Adesso, which is an app, and we're going to share it with you today, all about you. AI is all about you.
That's great. Sorry. And we do have, I'm realizing she moved that away, and we have a QR code that you guys can all log in. And Suzanne's been kind enough to give everybody a 30-day free access to this tool to be able to use it. So at the end, please, thank you very much, because it's so important. So we need to bring that back up, please, and we'll just switch tabs and bring up the Adesso login. So a lot of what we've been talking about so far is sort of after the fact, so helping to diagnose. How can this and how can AI help before the fact in your wellness journey and help you care for yourself better?
Thank you for asking my favorite question. I was trained as a preventive cardiologist with a focus on women and heart disease. I changed it from heart disease to heart health because 80% of the time, I'm going to repeat that, 80% of the time, heart disease is preventable. Now, let me tell you this. When you go to your doctor and they do a risk analysis on you, 50% of the time it misses your own personal risk. And what that means is you're less treated, you're less likely to be given life-saving medications and diagnostic tools. So the first thing that we did in my Adesso is create an accurate risk assessment that is designed specifically for women. When you look at standard risk assessments, it doesn't ask things like menopause, adverse outcomes of pregnancy, hot flashes, and guess what else it doesn't ask? Family history. Does that make any sense to you? Doesn't make any sense to me. And so when we talk about prevention, it is not only all about figuring out those things that causes risk, but it's also important to understand the impact of your life on risk. And we know those are things like diet and exercise and stress and lack of sleep and all of these other things. But AI is so much about understanding who you are in the journey of prevention.
And that's great. And I know one of the things you and I talked about is wearables, and not just things that you have to pay for a subscription. You know, a lot of people have the Apple Watch and stuff, but on my phone, I have an Android, there's an app called Samsung Health that just tracks it automatically, and I don't even think about it. So you want to talk a little bit about that, how these everyday things women could just help themselves with right now?
Yes, and I have to tell you, I'm very proud to say Samsung Health has collaborated with Adesso, and we are actually part of their infrastructure. Everyday wearables, again, it learns so much about who you are. This Oura Ring is a little bit of an obsession of mine. I wake up every day and I check it, and it tells me, go back to bed. You didn't sleep well enough. And I'm like, okay, what do I do now? But then data becomes important if you do something about it. If you have a lot of numbers and a lot of information and you don't do anything about it, don't get the Oura Ring. Don't look at an Apple Watch. It means nothing. But what becomes so powerful is you take this data and you use it to become healthier. So my Oura Ring, when I don't sleep enough, my heart rate variability, which is a sign of really how internally healthy and resilient you are. It looks at your autonomic nervous system. The sympathetic, which is a fight or flight response, increases your blood pressure and your heart rate, versus the parasympathetic, which is really your resting resilient response. So it will check for that heart rate variability, and if it's very low, it means I'm not very resilient. So wear a mask before you go to work kind of thing. And all of this data becomes something that I can look at, and when it tells me my heart rate variability is low, this might be a day that I actually rest a little more, that I actually take a little better care of myself, and I'll go to bed earlier the next night. But all of these tools are all about you and all about your daily journey, and they become more and more specific and sensitive to understanding your patterns, your health journey, and they enable you to take steps to become the healthiest you can be.
So that's great. And it's funny, I have in my car, through OnStar, I have these car diagnostics, and it pops up and it says your battery is critically low. And I almost feel like this is the same thing.
Exactly.
That you need to do something for yourself, like you would take care of your car, your vehicle.
Exactly.
That you need to do it for your own health. So how do you spell the Oura Ring, in case anybody was interested? It's
Oura. And I'm at a conference these past 2 days, and I snuck over here to join you guys, but it's a femtech conference, and the product development person from Oura Ring was there, and really got to speak to her a little bit yesterday. So one of the things that they're doing now is temperature. And for women who are menstruating, their temperature changes. So they're designing it very specifically to women's health and women's needs. And I think maybe I wasn't supposed to disclose that, so don't tell anyone from Oura.
No, but that's great. But outside of, of that, like we were talking about earlier, there are everyday things that are already embedded in your phone. There are apps. I was telling the doctor, I was on Instagram and I got hit up with an ad and it said, oh, just download this free app, put your phone on your bedside, and it will monitor when you sleep, how often you're breathing, and even if you're farting in your sleep. And I started laughing. I said, okay, well, that was an ad. It got my attention. But do you have any other ones that you might like, a Fitbit or something that you think that's helpful when people come in?
Look how crazy I am. I have a lot of devices on me. So this is the Apple Watch. It does a lot. It's complicated. And part of why I like it is because it has my phone and my email connected to it. And I have a son. And if I don't have my phone with me because I'm in a meeting or I'm with a patient, if there's an emergency, I know he can get me. That for me was very important. But what it also does is it tracks my steps. It tracks everything about my life. And in fact, on my Adesso, in the beginning of my Adesso, it says, do you want to connect to Apple Health, which is on your phone? And we connect to all of these devices, so you can track everything through my Adesso every morning. It will wake you up and say, how are you doing today? And that question in itself is something that we actually don't usually ask ourselves. How are we doing today? And if you start your day with that simple question, it begins this process of self-reflection. And that process of self-reflection is the first step in checking in. And if you don't connect your heart and your head and your heart, you sometimes neglect what you need to feel healthy and feel good about yourself.